Assalamualaikum warahmatullahi wabarakatuh. Good afternoon all. Introduce myself. My name is Bagus Dewantoro, and here I will tell about my journal. The title of Sports Participation and Myocarditis, Influence of Sport Types on Disease Severity. In the beginning, I will tell the introduction. Acute myocarditis, or EM, is an inflammatory disease of the myocardium, which is commonly related to viral infections or immune-mediated disease. It mainly affects young males, and its incidence is 22 per 102,000 people approximately. EM in athletes is a source of concern from diagnosis to sport return and medical follow-up. Postmortem studies in athletes who experienced sudden death found that EM was diagnosed up for 7 until 10% of cases. Moreover, intense endurance training may increase the susceptibility to viral infections. The links between sports practice and EM are both close and poorly understood. The purpose of this study was to evaluate in sportsmen who experience EM the relationship between the category of sport practice and the severity of the disease. And next, I will explain about body. Number one is population. We retrospectively analyze all hospital records from consecutive adult patients hospitalized in the Toulouse University Hospital from 1 January 2009 to 31 December 2019 with an international classification of disease 10 revision or ICD-10 Separation diagnosis of EM. To retain the diagnosis of EM and be included in the study, patients had to have the following criteria. Number one is participation in sport, more or less 2,5 hours per week, and the onset of symptoms more or less 1 month from hospitalization. And then a positive endomyocardial biopsy, or according to the Dallas criteria, or a positive cardiac magnetic resonance, or CMR, or 2 or 3 like Lewis criteria, combined with an evaluation of blood troponin, or IC or TIC, above the 99 percentile. To avoid any possible confusion with differential diagnostic, we exclude patient of 70 years old, patient with significant coronary artery disease, patient of 50 years old without coronary, imaging, and patients with alternative diagnosis or age stress cardiomyopathy. Next, data collection. All subjects were contacted by phone calls and submit a standardized questionnaire regarding their sport activity at the time of diagnosis of EM. Data relative to medical history and EM were collected via the electronic medical records software and hospital database. The study is conformed to the principles outlined in the Declaration of Helsinki. It is registered in the Register of Retrospective Studies of the Toulouse University Hospital, or Numbers Register, RNIPH 2020 until 1025. 125. I'm sorry. And covered by the MR 004, or French National Commission for Informatique and Liberties number 22067230. This study was approved by Toulouse University Hospital and confirms that ethic requirements were totally respected in this report. Next is discussion. In this retrospective study that include 82 sport people who experience an EM, we describe interactions between the way of practicing sports and EM severity. Main result can be summarized as follows. 1. Practice of high-intensity power sports or mid-cells class 3 sports was associated with complicated EM. 2 is practice of high-intensity endurance sport or mid-cells class IC sports was associated with uncomplicated EM. Number 3 is a high practice frequency, more or less 6 hours per week, trend to be associated with complicated EM. Complicated forms of myocarditis are usually associated with more extensive myocardial lesions. Such lesions can be attributable to an overlap between pathogens, or mainly viral replication, and immunity or cell injuries indicated by natural killer cells, macrophage, and activate virus-specific T cells. Regarding links between pathogens and sports, we can hypothesize that sport promotes the cellular penetration of the virus. Indeed, murine models show higher viral titers and larger myocardial fibrosis in exercise mice infected by Coxsackie virus. Secondly, participation in sport affects immune system modulation. For example, practicing a high-intensity endurance sport can result in a significant lymphocytopenia, or decrease in circulating T cell and natural killer cells, which persist throughout the 3.5 hours of recovery. Experimentally, in exercise aggravate Coxsackie virus B3 murine myocarditis. T. Lymphocyte suppression can lead to a decrease of myocardial inflammation and necrosis. Therefore, high-intensity endurance sport may be protective against complicated forms of EM. On the other hand, practicing a high-intensity power sport leads to lymphoptosis, or mainly natural killer cells, followed by a rapid return to normal 30 minutes. The promotion of natural killer cells involved in immune-induced lesion in myocarditis could explain the association between several forms and power sports. EM are mainly viral, but can be related to toxics. The use of doping substance can have harmful effect on the heart. In our study, very few patients admit to consuming such substance. However, it is likely that this use was hidden. The practice of high-intensity power sports or weight lifting and a high practice frequency are potentially associated with doping. It is therefore possible that this is an explanatory factor to our observation. And last is conclusion. For conclusion is in the setting of sport people (EM), the pattern of sport participation is associated with the presentation severity. Thank you so much for your attention. I'm sorry if me made mistake for presentation today. I will leave for Zoom meeting. Assalamualaikum warahmatullahi wabarakatuh.